The raging pandemic wave has taken its toll on the national capital as newly reported cases seem to have crested after 2 weeks of exponential spread. As such, the spread is beginning to radiate to the next-door neighbors of Bulacan, Rizal, the Calabarzon region that PTV's Mark Fetalco sums up in this report.
The OCTA research group said the reproduction number of COVID-19 in the National Capital Region dipped to 4.69. According to Dr. Guido David, a sliding reproduction rate indicates a slowing down trend. On the other hand, Health Secretary Francisco Duque III asserted that it's too early to declare cases are already on a downward trend.
Premature. Kaya lang naman mababa yan. Tandaan natin, galing yan sa Sunday testing output. And usually Sunday, mababa ang testing output. So this is not an indication that the peak is over. We might still be in the acceleration phase of our surge.
For WHO country representative Dr. Ravindra Abhyasinghe, the imposition of alert level 3 in the NCR and other nearby regions shows a significant reduction of mobility and a corresponding impact on transmission. Despite this, the WHO and the DOH have observed spikes in COVID-19 cases in some regions outside Metro Manila.
May be an early indication that we are seeing a plateauing, but we need to be aware that we will continue to see total numbers of cases increasing as the virus spreads out into other regions like Region 3, 4A, and even Region 5, Visayas and Mindanao.
According to Duque, the increase of cases in other regions could be due to the Omicron variant. However, he noted other factors such as the holiday season.
And that is why I call upon our regional directors of the Department of Health, the DILG, the local government units in these areas to ramp up more aggressively their vaccination of their citizens.
Duque also reported that the number of deaths amid the current surge is lower than the number of fatalities during the Delta variant surge. But the WHO warned that the Omicron variant will soon be predominant in the country, replacing the Delta variant. Earlier, the WHO called on nations to stop categorizing the Omicron as mild as it is still killing people across the globe. With this, it urged the government to still prioritize the vulnerable population when it comes to testing and vaccination. Infectious disease expert Dr. Ronchin Solante also advised to continually vaccinate those with immunocompromised conditions in preparation for the next variant of concern.
As long as there is transmission and as long as there is the ability of this virus to lodge in our host cell, particularly the immunocompromised individual, no? That's why we need to prioritize protecting this population, because the next variant of concern will also be in this group of individual.
Mark Fetalco for The Nation.